Outcome measure. Traumatic brain injury is a disruption in the normal function of the brain that can be caused by a blow, bump, or jolt to the head, or when the object pierces the skull and enters the brain tissue. The patient will experience loss or decrease of consciousness, amnesia, muscle weakness, change in speech, and alteration in mental state. Balance Error Scoring System is an objective measure of assessing static postural stability. These tests have 6 conditions, each tested barefoot, eyes closed for 20 seconds each. So mag-time po 20 seconds, so ang patient dapat naka-eyes closed. The double leg stance in the foam surfaces. So another 20 seconds with the patient eyes closed. The single leg stance on the firm surfaces with the non-dominant foot. Again, with the patient eyes closed for 20 seconds. Foam surfaces with the non-dominant foot. Stance with the non-dominant foot in the back for 20 seconds with the patient's closed. In the firm surfaces. London stance with the non-dominant foot in the back in the foam surfaces. Each trial is scored by counting errors, and the maximum number of errors for a single condition is 10. Quality of life after brain injury is a health-related quality of life instrument for survivors of TBI that includes a person's subjective perspective. It is a 37-item scale with 6 subscales, and the first part assesses satisfaction, with 4 subscales: the thinking, feelings and emotion, autonomy in daily life, and social aspects. The second part is devoted to bothered questions, and it is composed of 2 subscales: the negative feelings and restrictions. Give the questionnaire to your patient and explain to them how to do it, and let them answer. Scale scores. So the lowest possible value of 0 have the worst possible quality of life, and the maximum value of 100 have the best possible quality of life. High-level mobility assessment tool is a unidimensional scale designed to assess high-level motor performance in TBI patients. It has 13 items that assess a wide range of high-level activities. Walking. Instruct the patient to walk at the maximum speed. Walking backwards. Instruct to the patient to walk backwards at the maximum speed. Walk over obstacle. Ask patient to walk over a brick or box without contacting. Running. Ask them to run as fast as he can. Skipping. Ask the patient to skip at maximum speed. Walk on toes. Ask the patient to walk on toes and heel contact is considered failed. Hopping. Patient stands on their affected leg and hops forward. Bound affected. Patient jumps from one leg to the other. Bound less affected. Patients stand behind a line on their more affected leg. Upstairs. Patient is asked to go upstairs without holding the rails at a normal speed. Downstairs. Patients walk down stairs without holding the rail. Score sheet. 0 lowest and 5 the highest. And the higher the score, the better the functional mobility and balance, and the lower is the lesser. Bell's palsy is a condition that causes a temporary weakness or paralysis of the muscles in the face. Sunnybrook Facial Grading Scale is a tool used for clinical evaluation of the facial nerve function. It comprises 3 areas of evaluation: the resting symmetry, symmetry of voluntary movement, where it uses a 5 standard expression: the forehead wrinkles, the eye closure, the open mouth smile, the lip pucker, and the snarl, and lastly, the synkinesis. Slowly close your eyes. Open. Slowly. Okay. Then next, smile with no teeth. Smile with teeth. Okay. Then lip pucker. A perfect score of 100 points represents normal facial symmetry. Facial Disability Index is a brief self-report questionnaire of physical disability and psychosocial factors related to facial neuromuscular function. The questionnaire is divided into two sections. First is the physical function, and next is the social function. Explain the questionnaire to your patient and tell them to answer it honestly to what they really feel or function during the past few months. This is the scoring of the questionnaire. Brachial Scale is used to determine the severity of the facial nerve dysfunction in people with facial palsy. Tell your patient to do any facial expression, then measure the upward movement of the mid-portion of the top of the eyebrow and the outwards movement of the oral commissure. For both the eyebrow and the oral commissure movement, 1 point is assigned for every 0.25 cm motion up to a maximum of 1 cm. The scores for each structure are added together to give the Brachial score, and the maximum score obtainable is 8 if both structures move the full 1 cm.